Welcome everybody to this very, very important and exciting webinar. My name is Michael Graglia. I'm almost done with breakfast. And we have a star-studded panel here. On the top of my screen, at least, wearing purple, we have Lauren, who is the operations manager of SRF, and you all know because she makes it all happen. And we have Virginie, who has many hats. One of them is a SRF, a Syngap mom. One of them is an SRF board member for many years. And one of them is the rare disease lead for Citizen, AKA Invitae. And we are very grateful to both of them because SRF would not be as successful as we are without them. And then there's three other people on the screen who I will ask Virginie to introduce because this is really her show. But before we jump in, I just want to point out how exciting this is because something really big is happening here, right? We have a company in Praxis who is working on Syngap Therapeutics, and they have partnered with Citizen/Invitae to accelerate their work. And now they're asking a really important question, which is, okay, how could we handle seizures? And I'm gonna come back to how important it is that all of us do this tracker later, because tracking seizures for Syngap is really complicated. And I think the sooner Praxis and others find the best possible way to track our seizures, the better. But all I wanna say, aside from that, I wanna say two things. One, I told you over a year ago that Citizen was important and companies would use it to accelerate Syngap research. And I'm right, it's happening. So sign up for Citizen One. If you haven't signed up for Citizen, citizen.com/Syngap1, sign up immediately. If you have signed up for Citizen, go in there, refresh your records if you haven't done so in the past 6 months. And then point number two, this isn't just for education. This is a call to action to do something useful, which everyone will talk about. So I will shut up. Sign up for Citizen, refresh your data. Thank you to everybody here. That's the most important message. Thank you to everyone here. We're all working for the same thing, which is therapies for our kids. And with that, Virginie.
Hi, everyone. Thank you for joining. Really excited about that webinar. And I want to introduce today Kelly Dalby and Karen Utley from Praxis. And I'm going to pass it on to them. I really want them to share their story with you guys. They're both rare moms, so we are in great company. They get it, they understand what we're going through, and they're fighting for our kids. They're in our corner, and so I just wanted to open the room to you guys, and thank you for being here. We're really excited to have you.
Yeah, thanks, Virginie. We're happy to be here also. And I guess I'll quickly just give you an overview of my story. So one of my sons, his name is Connor. He's 13 years old. He started having seizures at 8 months old. And at that time, SCN2A was not yet on the standard genetic epilepsy panels. And so we went undiagnosed for the first 5 years of his life. And his seizures were relentless. He had a ton of other comorbidities. And I was just of the mindset that we have to get a diagnosis. If we find what's wrong, there will be a solution. And when we finally did exome sequencing when he was 5 years old, I was shocked by the news that he has an SCN2A mutation, and I'm sorry, there's nothing we can do. We don't know very much about it, and we have nothing to offer you. And so now that we at least knew the problem, I wanted to figure out a solution. And so I just started calling scientists in the area and trying to find other parents with this disease. But I ended up starting a biotech company with another parent and a scientist called RajCon after our two sons, Roger and Connor. And it was really just devoted to discovering treatments for SCN2A. And I know in other diseases, I didn't want this just studied for, a few decades. I wanted to find a solution for my son as fast as I possibly could. And we had some luck with an ASO program. We had great proof of concept in mouse models and other models. And so when it came time to partner this specific program for SCN2A, Praxis to us was the perfect choice, just with their pipeline of other genetic epilepsies. They were all about speed and how do we get to patients as quickly as possible. And so we licensed the program to Praxis. I've been working at Praxis now for 3 years. I was in clinical operations, and just with the work that we've been doing with Citizen over the last couple of years, I absolutely fell in love with this initiative. I see how imperative the data collection is to our genetic epilepsy programs. And so now for the past, I think 2 months, I've been running our natural history and diagnostics program in epilepsy. And I also have to say that so incredibly impressed with the Syngap community. When we chose the cohorts of interest for this calendar year, Syngap already had 150 patients on this platform. And so it wasn't a matter of having to recruit and wasting time. We were literally handed the extracted data almost immediately. I know they're still collecting the raw EEG tracings because that's very important to us at Praxis, but what a great community this has been. All of my interactions to date so far with the Syngap Research Fund has been just fantastic and top notch. So I couldn't be more excited to be here today and to be working with you guys on this program for Praxis.
Okay, so I guess I'll go next. I'm Karen Utley. I am very new to Praxis, but I'm very excited about this position as their patient advocacy lead in their epilepsy program. Much like Kelly, my daughter Samantha, she's my youngest of 3 girls, but she was diagnosed with CDKL5 deficiency disorder when she was 20 months old. She's currently 15, so I don't even think there was an epilepsy panel when she was born and her seizures started. She was about 10 weeks old when she had what I now know was her first seizure. We didn't recognize it as seizures at first. And of course, they escalated and it became very clear. She started missing milestones and we were on I felt like a chase to save her life. I mean, I was to a point, I just wanted a diagnosis so she wouldn't die. I felt like I was probably fighting a window of time. That was my biggest fear, right? That there was something we could do, but we just didn't know it. And of course, much like Kelly, I got that diagnosis and was told, we don't know anything. And I was at a world-renowned institution and they handed me one research article that basically said CDKL5 gene may cause problems, basically, right? And he said, when you read this, you'll know everything I know. And I thought, wait a minute, you're an expert. I need to know more than that. And long story short, I found a Yahoo support group that had a few parents in it, and we started the International Foundation for CDKL5 Research. And that's when I started learning about mouse models and iPS cell lines and the importance of a registry and all of this stuff I had no idea I would ever be interested in because all I ever wanted to be was a mom. And suddenly I needed to be a mom, a doctor, a scientist, everything. And I've done a lot of work with the IFCR, and that has led to some experiences that made this job just seem like a perfect fit because I love the DEE community. My heart is here and I want to help, and I see a company that I feel like is going to help, and to get to be a part of that is very exciting to me. So I think that covers it.
Thank you, Karen.
I will say, please, I am the patient advocate. So if you want to reach out to me, my email is my first initial and my last name, kutley@praxismedicines.com. So feel free to reach out. It's always great to connect.
Thank you, Karen. Really excited to have you here. And thank you, Kelly, for pointing out how incredible our community is. I know Mike, Lauren, Corey, and I always keep saying, please sign up for Citizen, please sign up for Citizen. And hearing it from you it's a big deal. So to all the parents out there who have already signed up, thank you. As you can see, your work and being proactive paid off. We were able to deliver 150 patients to Praxis. We cut down the time of recruiting. We're ready to go. And today we are here for another effort that I'm asking the community to rally and engage and participate. And it's the seizure tracker. Kelly, do you want to say a couple of things about why we're asking the community to go over 30 days of filling out seizure information?
Yes, absolutely. So like I mentioned, the data that we're getting, the extracted data, we had 2 previous cohorts. We had an SCN2A cohort and an SCN8A cohort, and for 2 separate drug programs. And so this data enabled us to select scales because there's information about that in the citizen data, select our endpoints. And obviously in these 2 diseases, seizures are a primary endpoint. Not that that is the only comorbidity by any means. Seizures are a symptom among many, but it's easy to measure to see if the drug is helping. And so really in the extracted citizen data, the seizure frequency updates are happening in the medical records as often as the patient is seeing the neurologist. And we really, with this seizure tracker, want to track over 30 days what seizure types is each patient having and what is the frequency of those seizures. So to really thoroughly analyze that over a 30-day period to help us set in the protocol the IE criteria of seizure type, seizure frequency. So it's this knowledge that we're going to gain will directly impact the drug program that we have in Syngap. So it's incredibly important. And we know, I know personally, filling out a seizure tracker for my son is depressing. It's annoying. It takes time. I don't like anything about it. And so we're also offering, just for your participation for doing that, a $100 gift card, just like for our, thank you, and hope that, helps a little bit. But yeah, that's the point of why we're doing this. We need this data.
Thank you, Kelly. So if you're here, we'll go over how to participate in that seizure tracker and go over key information. But please, we've already showed up with Citizen. Let's keep going and let's have as many patients as we can enroll in a seizure tracker to really understand how the seizures are affecting our kids. That's important. That is the one thing, like Kelly mentioned, it is not thorough in the medical records. You're not calling your neurologist every time your kid is having a seizure. So that data is a gap in the medical records. And that's where we need your input. We need your point of view. And participating in that seizure tracker is going to really help with the drug discovery and get to treatment faster. So I'm going to jump in. Kelly, Karen, do you guys have anything else to add before I jump in my slide? Or Mike, looks like you have something to add.
Yeah, I do. I'm just so excited. I'm just so excited that we're doing this. But I want to underscore one point. There were 2 points, right? So we jumped in, and we've got this incredible team from Praxis, and we have Ivy and Virginia here from Citizen/Invite. I really wish you guys would just pick one name. It's very hard to say off all the time. But so for the community, like, let's remember, and if you don't remember, episode 58 of Syngap 10, right? I talked all about Praxis when they announced their ASO program. And so let's just connect the dots. Praxis launched a program. We haven't publicly said, I believe, that Praxis is licensed to Citizen data. Maybe I have said that, I don't know. But Praxis is using the Citizen data. And now what's happening, I feel like Virginia's just might have skipped this, like saying this in all caps. So I just want to say, because I like to say things in all caps. Kelly mentioned we are now launching a seizure tracker because we want richer data that we can get from the medical records because Praxis is serious. So the takeaway here is Praxis, who is a company that is accountable to shareholders that needs to make money, is spending money on learning more about Syngap. So we as Syngap parents should feel warm and fuzzy inside because that someone's getting serious about Syngap. That's exciting. But we need rich data. So there's an ask here to ask you to participate for 30 days in the tracker, which Virginia's about to show you how to sign up for and why. But before we go there, I know there's one question that's going to be top of mind for people. So Kelly and Karen, I don't know how you want to answer this. Syngap is a tricky beast, right? A lot of our kids, when medicated, it's not obvious. It's not like CDKL5 or SCN, where you can see the seizures. So some parents are going to be asking themselves right now, do I even need to watch this? Like, if I can't see my kid's seizures, should I be filling this out? And in discussion, different answers have been posited. And one of my answers is yes, fill it out. Because even if you have 30 days of light data, that's going to give Kelly and Karen stuff to go back to the science team at Praxis and talk about maybe we need to use EEGs more or other things. So before we go down the path of how do you sign up for this, which every single family should do. Every single family should sign up for this. Who doesn't need $100? Who doesn't want to get a drug for our kids? Can we just talk about if parents don't see that many seizures, should they still do this, Kelly?
Yes, we want to know that. Absolutely. If you think there's even a remote possibility that your child may have a seizure in a 30-day time frame, yes, please sign up and please fill it out. I will also add that part of Citizen, what Praxis is doing with Citizen is we take in every single EEG that Citizen is able to obtain from the first EEG all the way to the most present, and we are having those analyzed for background, for seizure activity, a very thorough initiative. And so we have that coupled with then a 30-day seizure diary. So yes, take it. If you think there's a remote possibility your child will have a seizure in 1 day out of 30, please take it.
And that's huge news by itself, right? Just the fact that Praxis is funding the collection of EEGs.
Yes.
And so let's review. Praxis is licensing the citizen data. They're paying more money to have Citizen call all these crazy EEG labs and collect this immense amount of data, which is a massive undertaking. And they're doing this seizure tracker. And then with all that data, they're going to figure out how to do a trial for an ASO for Syngap 1. This is like, we should all be doing the happy dance. And then we should sit down and listen to Virginie and sign up for the seizure tracker, because this is exciting.
Yep.
Okay, sorry, I'll go back off screen so you can have your party.
No, I like your enthusiasm, Mike. I'm always really excited every time we talk to the Praxis team. And now that this webinar, this is a big deal, guys. We have a pharma company. I know we keep saying it. There's a pharma company serious about it that are going to look at a treatment for our kids. This is not in the distant future, maybe in a pipeline or anything. They're looking at our data. So now let's jump into the presentation and how we get to it, how we start, how we participate. If my share screen is happy or not, I don't know. Let me see. There we go. All right. Before we jump into seizure tracker, little citizen updates. And as you know, I'm wearing a few hats. So I'm going to go with the SRF advocate, with a mom and citizen. So 179 patients are fully onboarded in our citizen database. This is great. Great job. High numbers for a very rare disease. And like Kelly said, we have data ready. Anyone who wants the citizen data, it's ready for 179 Syngap patients. Our goal is to get to 200 by the end of the year. So if you are not onboarded yet, if you have not finished, those 18 people have started and have not finished, reach out to us, reach out to me, reach out to Mikkel, whoever you want to reach out to, Corey, Lauren, and make sure you are on there. This is literally a way to put your kid in front of researchers and pharma companies without sharing personal information. So just a quick recap, if you are new to the Syngap community and have not heard of Citizen, we collect medical records on your behalf. You have access to those raw medical records. The Citizen team extract the key data from the medical records, and we share that de-identified data in an organized way with researchers and pharma companies. And it's valuable data. Proof, Praxis is using it. They've used it on many cohorts. Data is high quality, and it's saving us a lot of time compared to regular natural history studies. Second point, we are now collecting EEG tracing. This is hard work. It's really hard to get our hands on the EEG tracings, and there's so much information. And the technology to be able to analyze the EEG tracing, it's complicated, but Praxis is doing it. This is very exciting. Now, if you're already on Citizen and you're like, well, I don't see my EEG tracing on my dashboard, you won't, because this is like massive file. It's complicated. There's no point of us having access to it, to be honest. All we need is like the summary. That's enough as a parent. But the EEG tracing, the raw data is going to Praxis and they're analyzing it. So our team might reach out to you if there's mention of EEGs, and just to confirm that where we can push to get all the EEG tracing, because we need as many as we can. So if you get an email from Mikkel asking, where do you get an EEG? Please respond. That's super important for us to get our hands on every single EEG. Other update, Citizen launched an updated dashboard. So I'm going to jump off this screen and quickly show you what that looks like, because it's exciting. It's pretty. It's prettier than it was. It wasn't really pretty before. It was a little messy. But now we have that disease summary integrated in your dashboard. And the disease summary is pretty much everything that we've extracted from the medical records. We're sharing that de-identified with researchers, but you have access to that data in your summary. And with this live summary, what you can do is look at the provenance. So if you're like, I'm not sure who wrote that or whatever it is, you can click on the document It's going to take a while to preview, but it will show you the document that mentions like the Syngap what diagnosis. This should be my genetic report, and everything that has been found in TIE's records is on that timeline. And then you can just drill down even more. This is super useful for parents. I love it. We used to have to log in a different place. It's now in your dashboard. You can access it anytime. Other thing that I wanted to show today is, don't forget, so you've signed up to them, some of them 2 years ago. Don't forget to go out and ask for an update on your records. We want the cleanest and, you know, the latest data. So you can go to manage on your dashboard. The fastest way, because I haven't seen any new doctor, I go to institutions. So it shows everyone that we've collected records from. And then from there, I'm going to go to the neurologist. You click on request latest records. And so our team is going to go out and collect the records. You should start seeing them in your dashboard. And when it's time, we'll do an update on your summary to do a new data extraction. So every 6 months or so, just don't forget to do that. That's important to have the latest data. And again, so that's a new dashboard. You can access it from your phone or computer. But the very exciting part is that you have that disease summary. All right, so I'm going to jump back. Sorry, it's a lot of back and forth, but a lot of information to cover today. And then, yeah, don't forget to update your records every 6 months. To log back in to get your summary, it's app.citizen2i.com. And if you have any issues, just reach out to me. All right, seizure tracker. Here we go. Who can participate? Syngap families, if you fully signed up on Citizen. Why? Because we need a complete set of data. We need your citizen data, your EEGs, and your seizure tracker. That's what's going to give the clear picture of what's going on. So if you're not signed up on Citizen yet, that's fine. Sign up, and then you'll get an email to start the seizure tracker once we have all the records collected. How to participate, I'll show you, I'll walk through all the slides, all the steps, but you should have received an email with an invitation from Invitae Research Studies with an invitation to participate in the Rare Neurological Disorders study. So it's kind of a standard email, but I'll show you what it looks like. Just click on that email, accept the invitation, and then start following the steps. If you are fully signed up on Citizen, or think you're fully signed up on Citizen and have not received that email, reach out to us and we'll figure it out. Timeline. We would like you to start the seizure tracker no later than September 1st. I know there's some chatter in the support group saying, well, my kid only has seizures at school, doesn't start school until September. Just start by September 1st. If you need a little bit more days, let us know. But the idea is like to be successful and collect as many days as you can. And we can't drag that on too long because we want Praxis to have the data as soon as we can. And again, it's like 30 full days. So it's painful. I mean, Kelly said it, so I can say it. It's a little painful. But also helpful. Some of you have already done a seizure tracker last year, I believe. So it went by fairly quickly, and that's good information. Like I remember figuring out, I was like, oh, now that I have to count, he has more or less than I thought. So it's interesting information on the parent's perspective. If your child doesn't have seizures, should you participate? So there's two kind of scenario. The one that we covered earlier, your child doesn't have a lot of seizures, mainly controlled. You can, there's a question about, does your child have a history of seizures? Say yes to that. And it's okay to say 0 for every month, for every day. It's completely okay. Take it. Once you signed up and laid everything out, it takes 1 minute every day. That will be helpful. If your child does not never had a seizure, it's good for you to still answer that question and say no. That way we'll know, okay, there's, number one, we'll know that the Syngap community is ready to participate in research because we have a high response rate, even if it's in no category. but just let us know and we'll be able to share that information with Praxis. Compensation. So you will receive $100 if you complete every single day for 30 days. If you have 28, not eligible. 30 days, because that is very important. And if you skip days, I'll show you, it's okay. You can go back and backfill it. Try not to get too much gap in between the days, because we tend to forget what really happened from day to day. All right, so let's jump on it on how to sign up. This is the email you're going to get from Invitae. Click on read it. I didn't read it because I never read it, and I'll go through the button right away. But you can read it to have more information, and then click on accept your invitation. That will take you to PINS, to a different platform. So it will not look like, it's not part of your citizen profile. We're using a different platform for surveys. So I know that's a little bit confusing, but the data is linked. So, and it's linked by the email address you use on your citizen account. So everything is linked. It's just a different interface to track your seizure tracker. So if it's going to be your first time on that platform, so click on sign up. It will have quick information on how to create an account. The email address, please use the same email address you use for your citizen account. And that's the inbox where you received your invitation email. So if you don't know, if you're like me, you have 10 email addresses, you don't know which one, it's the one that has the invitation email. And if you're not sure, send me an email and I'll be able to tell you. Then once you fill out that form, it will ask you to verify your email address. And I promise, the first, like getting the account set up is kind of like the most painful. It takes like, I don't know, 5 to 10 minutes, depending on how you're navigating through the questions. But after that, every day, it's just like literally 1 minute to log your seizures. So this is just like the first part is a little painful. You will get the email to validate your email address. Then you get back to the login information where we want you to log in. I'll have those slides. I'll post those slides on the Citizen SRF group, and then we can email them out as well if you want the detailed instructions. Then we have to fill out a quick survey. This is just basic demographic information. The first 2 questions, health reason for registration and other reason for registration, there's a drop-down menu with 3 disorders listed. There's SCN2A, PCDH19, and Syngap. On those 2, please select Syngap. I mean, obviously, this is why you're here. It's a Syngap study. And then fill out the rest of the information. You won't have to touch that survey ever again. Then we get to the consent phase. So there's like at the top of the screen, there's like several questions. Who you're willing to share your data with. That's up to you who you're sharing. I say yes to everybody because I want my kids' information to be out there and share with researchers and advocacy group and all of that. The one that I will flag, if you say no to all the other, but you say yes to the last one, please, it's not marketing email. So we're not going to start sending you a bunch of ridiculous marketing emails. This is to get your reminders. And that is super helpful because I started my seizure tracker as a test 2 weeks ago. And I did not get those emails because I said no to that. And I forgot to fill out my survey. I forgot to fill out my seizure tracker. So please say yes so that you can get those email reminders. And it will allow us to, if there is another survey that you're going to need to fill out down the road, to email it to you quickly and with your consent. So that's the consent part. At the bottom, just for ease of use, you don't have to reset your password. You can skip those fields. They're optional. I was confused about why they were there. You don't have to reset your password. You just set it up. So no need to reset it again. You can skip those steps. All right, now you're logged in, you have your account. We're getting to the Seizures business. In the to-do, you'll see two items, Simon Searchlight consent and the seizure type survey. We'll start with Simon's. What is that consent about? This allows us to share information with Simon Searchlight. If you're not familiar with Simon's, that's a whole different webinar that we need to do. Sign up on Simon's. It's rich information, lots of surveys, great feedback from families. So just sign up on Simons. It's another database pretty much where that collects information on your child. And the reason we have a partnership with Simons is so that we can link the unique identifiers. So if Praxis or other researchers want access to the 2 data set, they are able to know without identifying anybody, this patient in Simons equals this patient in Citizen. And so that way they have the full picture of, they have rich data. So consent to Simons first. And it's optional, you don't have to, but it's just, again, it's going to help create a rich data set on Syngap data. And it's quick. You just say, I consent, next, then click on your profile, and then you're back. The next survey is a seizure type. You're only going to have to take that once. And that's a really, that's a smart way, I think, to do a seizure tracker. We all describe seizures in a different way. If you remember the previous tracker that we've done, we had a preset list of seizures. And to be honest, I had to Google half of them because that's not how I describe my kid's seizure. I have no idea what's the medical term for some of them. And so this really allows you to set the 4 seizure types in your own words. And I don't know if Kelly and Karen, you guys want to jump in on that?
Yeah, and so like Virginie said, if, for example, let's say type 1, you write down tonic because that's how you describe your child's seizures, or maybe you don't want to put a name to it, but you want to describe what happens, and maybe it's right arm raises, left arm goes out, face turns to the side, and that is fine. However you would describe it, or if you want to put a name to it, but then that would always be your type 1 seizure. And so then when you're well, I'll let you go into the next part.
Yeah, when we're filling out the survey, you'll have reference of those 4 types of seizure that you're referring. So enter the 4 most common types, the one that you see on a regular basis. I think you'll see what I've entered for Thai, but that's open text. So enter what you're comfortable with, how you describe your kid's seizure. And the first above that, the question, does your child have a history of seizure? That's the one that I mentioned earlier. Click yes if they had at least 1 seizure in their life. No if they've never had a seizure. Once you fill that out, you get to the daily seizure diary. And that's where you're going to start filling it out every day. So this is what it looks like. At the top, you see Thai seizure type. I entered eye flutter. I know that's not a scientific word, but that's how I call it. Absence. Complex partial, that one I had to Google because his are super weird and they fit in that category, and then tonic. And so you just, if you forget which one is one, you're always going to have that seizure types with type 1, type 2, type 3, type 4 as a reference. And you can see at the bottom, you will have the 4 types and then how many you've noticed during the day. So from 0 to 10 plus. So that's what you have to fill out every day. And then the date is for the date you notice the seizure. So not necessarily today. I usually report, what I've done is I report today what happened yesterday. That way I have the full day. I'm not missing. If I do at noon today and he has like 10 more seizures during the day, I'm missing that data. So really, it's a good idea to start to record the previous day. So you have the full picture. In that, a few tips, like we really want to get the better picture. So if your child is at school or with another caregiver, with therapists, during those 30 days, ask them to count and ask them to describe what they're seeing. That's very important because we don't want we can't, it's not just what you see, it's during the entire day. So get your team together, tell them you're doing a seizure tracker, and here are the 4 types that you're seeing, and have them help you count. That's very important. That's something, by the way, we should always kind of do, because that would give us a real picture of how many seizures our kids have. And when we are upping medication or changing or everything, we should be able to have that information. But it's very, very critical for that 30-day period. Once you're done, it will be that seizure, that daily seizure will be under the completed list. That's where it becomes a little finicky. When you come back the next day, you're going to click on daily seizure diary, click on the name of the survey, and then do retake survey. And that will open up again. So every day, that's all you have to do. You log in on your profile, click on daily seizure day, retake this survey, and it will be cleared out and you have a new date. And then you can see the diary entry right here. So you can see all the different dates as you go, you'll see all the different dates. So if you're missing a couple of dates, you'll be able to track which ones you've missed. So that's important. Again, you need 30 days. So if you skip a few days, go back to your history to see which ones you've missed. And at the end, and then this is the daily reminder. So if you subscribe to your to the email being sent out, you will get this every single day in your inbox, reminding you to take the survey. And then you can click on daily seizure diary, and that will take you directly to log in and then take your survey. If you miss, I believe 2 days, Ivy, correct me if I'm wrong here. I think if you miss more than 2 days.
Yep, it's actually up 48 hours. Where
48 hours, you will get an oops email with a gentle nudge to like, please do it. And we will send frequent reminders also on the Facebook, on the Citizen SRF Facebook group to make sure you guys are not forgetting that. All right, so quick summary, and then we can go to the Q&A. Simon's bidirectional consent. This is optional, but important to be able to link the two databases. Every day when you need to take your daily diary, click on the name of the diary and retake. That's those 2 steps. It's 2 clicks, fairly easy. You need to do it every day for 30 days. And that's how you're going to get your compensation, your $100. And that's how we're going to get the most, the cleanest data out of it. Check the history to see which days you've missed. You can backfill. So if you missed, 2 days ago, you can enter that date for 2 days ago. Ask school providers so that you get the and caretakers so you can have the biggest picture and have the exact count. Exact count is kind of hard. Let's face it, because some of us, it's hard to capture. They're so quick, but be as precise as you can. If you have questions, want to get reminders and get updates on the citizen data and all the different studies, join the SRF Citizen Facebook group. You can search it and then just ask to join. It's a private group, but we share good information related to citizen on there. And any question, you can always reach out to me. This is my Invita email address. If you want my Syngap Research Fund, it's virginie@syngapresearchfund.com or .org. And I mean, you can also find me on Facebook and whatever. I'm here. And that's all I got. So I don't know if we have any questions. If the Praxis team, if you want to do any closing argument, and then Mike, if there's anything you want to say.
Kelly, Karen?
I don't think I have anything else to add. I think you did a great job, Virginia, of taking everyone through how to start filling this out and how to register. Yeah.
Okay, so let's go through. There's a few questions in Q&A, and I'm really excited to see. There's about 20 parents in the audience, and there's another. Last time I looked, 6 watching on the Facebook Live, and then this will be recirculated and we will pound the table. So a lot of people are going to watch this. So if any family members want to just ask questions live, just message me or write it in the chat or whatever. But let me go through this. JJ reiterated my point about what if I don't know if my kid is having a seizure because he's already on 3 meds. And I think the answer there is, because, and actually it's the point to make here is we know he's on 3 meds because we have Citizen, right? So what's beautiful, what's beautiful about this is because Citizen is collecting your medical records and synthesizing your data, we don't have to ask you to type whatever, clobazam or Onfi or whatever. I can't spell Onfi. I mean, I'm dyslexic, and these drug names make me crazy. But you don't even have to fill in and tell Citizen what drugs you're on, because we have your medical records, Citizen/Praxis will know that your child is already on 3 meds, and then they will have the EEG tracings, and then they will see you say, I'm not sure, maybe at 1, maybe at 2, maybe at 10. And then they're going to be like, wow, I mean, hypothesis. Praxis is going to see and hopefully share this information so that everybody can appreciate. It's really hard to compare what the EEG shows with what we show. But the only way to do that work is to take all the medical records and the EEGs and the patient reports. And that's a ton of work. If we were paying for this ourselves, it would cost a lot of money. Praxis is spending real money for the benefit of our children. And all we have to do is log in 30 times in the next 30 days. So I'm on bended knee here. This is everybody can and should do this. And thank you, Praxis, Kelly, and Karen, for paying for this. And then Nicole is asking, how do we request an EEG tracing from the doctor? Not to beat a dead horse. You don't have to.
Me too.
Virginia, can you
Our
beat the
team
dead
is
horse a
doing
little
it.
bit?
Yeah, our team is doing it. This is why way back when SRF chose Citizen, because it was a low lift for families. We, Citizen, Invite, do all the work. All you have to do is sign up 10 minutes, and then we go out and collect the records. Then what we do is once all the data is extracted, we are able to tell where the EEGs have been done. And because it mentions in the medical records, it references EEGs. And so then our team goes out with that information and requests EEGs. So you don't have to do anything. In some cases, we're seeing that there are EEGs mentioned in the medical records. We put in a request. The hospital's like, we don't have any EEGs. So we come back to you and it's like, can you verify that the EEG was done at this hospital, et cetera? And if it's the case, then we're sending the bulls. Like, we need those EEGs. That's how it works. So you do not have to do the work. It's so painful to collect those EEGs. It's not on the families. It's not your job to do it. It's our job. This is what Citizen is doing.
Yeah, and I'll also add, that's one of the things I liked about this initiative, is it was so low burden for the caregivers. And something that I learned in this process was my son's data, he's 13 years old. The institutions only have to hold the data for 7 to 10 years. And so that data would have been lost. The first EEG, the medications he was on, all the different symptoms. So now I have that. It's in my parent portal. It's invaluable. I, as a parent, can share that with anyone that I choose. So I just wanted to add that.
Yeah, no, that's a really good point, especially when we're trying to build a natural history on the disease. So understanding how it starts, how it evolves, how it affects the patients, and if we're missing those early years, we're missing some of the picture. So sign up as soon as you can, so we can get that data sooner than later.
There's a few more great questions in here. I just want to make a Virginia, can you stop screen sharing? Can we just go to our beautiful faces? Before I go to these next few points, I want to just encourage the 20 parents that are watching this live right now to really go into the groups, the regional groups, the global group, the Syngap group, all the groups, and just please, people are so sick of me saying this, but it might be refreshing if they heard it from you. Like, every parent can sign up for Citizen at no cost. Every parent can do this for free. And by sharing that data, we're helping all of our kids. So, there's 2 asks in this. 3 asks. Sign up for Citizen, take the seizure tracker, and then please do a little bit of evangelizing, because we need as many parents as possible to sign up for this to get as much an understanding of Syngap as possible. Okay, enough of that. JJ is always asking great questions. Any advice for asking schools to recognize and count seizures?
Any advice? I can only share what I did. Is I sent out a note and I was like, I'm participating in the study, and I need teacher, provider. Ty has a one-on-one at school. If they see seizures, to track it. I actually started last year when we did the first seizure tracker, and they kept doing it. So now it's part of our daily communication. We have a spreadsheet where they add the comments of the day, and then we have a seizure counts column in the spreadsheet to count how many seizures they've seen during the day. So that's something that should be done. That's my opinion as a mom. But I would definitely tell them it's important. You're part of a study. There's treatments in the pipeline. We need to understand how many seizures he's having a day.
And that's
And
frankly,
then-
I'm sorry, Karen, go ahead.
Hi, I'm just going to interject. One of the things I do, some of Samantha's are hard to recognize. So if I can capture on video,
Videos.
and then I have that to show the caregiver and say, if
Yep.
you see this, this counts. Like you may think that eye deviation is not a big thing, but it is, you know. So that's a good tip as well. If there's something that may be hard for them to recognize, if you can capture it and show them, then they can catch it better.
Yeah, I created an album on Amazon that you can share with a link, and it's at the top of that tracker. That way anyone that have access to that tracker can always look at it and reference. I still have teachers, caregivers say, oh, he was fascinated by the light today. And I was like, well, that was probably an absence. You know, it's in the video. Please go back to the videos.
Samantha's new one is teeth grinding. Well, sometimes she just grinds her teeth. So if you hear her grinding, you better look. If she's clamping her hands and looks kind of red, it's a seizure. It's not teeth grinding. So yeah, there's always weird intricacies.
Yeah, and I mean, I'll just observe, like Ty, Tony has a one-on-one, and like Ty, I get a daily report. Unlike Virginia, I don't read it every day, honestly, but I probably should. And I think getting those one-on-one aides to think about and return seizures, because yesterday we were taking Tony for a walk. He was chilling, he was walking. All of a sudden he starts blinking a lot. And then he was really hard to handle for an hour. And it was like the most classic case of everything's fine, seizure, behavior gone to bad places. So yeah, I think that's the advice, JJ, is just find the person who spends the most time with them and beg them to report it. And then Roy's going a little off topic into tech land, but it's a cool question. Are there any signs of seizures we can get from a smartwatch? Any thoughts on this? Wearables as seizure detection? Kelly, have you thought about this at all?
I know that one of the wearables that we're using for one of our other programs, that it only detects tonic-clonic seizures. And so then you're missing all of the other potential seizure types the patient would have. So sure, if you want to just pick up tonic-clonic seizures, but if your child has other types that you want to capture, that's probably not the way to go.
And I would say with, Syngap in particular, as most of you know, Ty has a service dog, and we have the Sammy camera in his room that never picked up most of his seizures. Since we have the service dog sleeping with Ty, almost every night when he falls asleep, she alerts. I can't see anything, but she knows.
But we know from the Kadam paper that that's what our kids do. They fall asleep, they seize, they try to sleep, whatever. Susie Byler is a grandma who's on this and is saying her daughter has absence seizures, just diagnosed with Syngap last month. You guys can read the whole thing in the chat. She fires off a lot of seizures in her sleep. And then we know that because she wets her bed, now she's 10. So yeah, Susie, I'm honestly, I no longer have the spreadsheet in my head. If she isn't signed up for Citizen, please sign up for Citizen. And then you or someone, please do the seizure tracker.
Yep.
We need all the data we can get to help her and other kids. I just want to make the point. I mean, we have CDKL5, we have SCN. You're 2A or 8A, Kelly?
2A.
I mean, CDKL5, SCN2A, very advanced groups. They have therapies. Syngap, we're a hot step behind them. I'm not exaggerating when I say there are hundreds of other rare diseases that if they were watching this webinar would be red with jealousy.
Yeah.
We have a drug company working, we have Citizen in place, we have studies happening that bring us right to the precipice of a therapy.
Another great thing that I love about the Citizen platform, this data isn't just for Praxis, right? Like we just want drugs for our kids. And so this is open access data. Any biotech company, any pharmaceutical company can come in and license any one of those cohorts. That's so important. I feel as a parent, if I take my Praxis hat off.
Yeah.
Yeah.
I would
That's
agree.
a very good point.
And one thing that I will piggyback on what you just said, Mike, we've had success recruiting for Citizen. Recruitment is top of mind for pharma companies. Literally, that is the first question that when they come to us, they're like, how many patients do you have in Citizen? So we tell them. And then, do you think if we have a clinical trial that we can engage those patients? That's the bottom line. It's great to have a natural history study. It's great to have patients there, but we need to show those pharma companies, Praxis and others, that we can show up when it matters. Meaning when there's a clinical trial, it's not going to take months and months and months to reach out to patients and recruit. That is so important. And right now, Syngap has a reputation of showing up. And this is right now it's 30 days. We did the 10 minutes thing, sign up for Citizen. Great. Now it's 30 days. Can we do that? Can we get all 179 to do that? And then the next step is going to be eventually clinical trial. That is so important.
Yeah, I want to just bring it home because we're coming to the bottom of the hour. Virginie, when does it start? When does it end? I mean, I realize you want 30 consecutive days of data, but is there a time frame inside of that? Like, what's the deadline? Yeah.
So it starts, I think everyone got the emails on Monday this week. So if you have the email in your inbox, you can start. And we would like everyone to start no later than September 1st. So that we can get an idea of, we have X amount of patients taking the surveys, because it takes 30 days. And I'll let Kelly say if there's extensions or anything, but we really want to get as many families as we can in that short time, because then it takes time to get that data back. And then I have to go out and look at the Citizen and EEGs again, speed up.
So the answer is, I love doing webinars with Virginie, because then people don't say, Mike, you talk too much. I'm like, whoa, look at Virginie. But really, so the answer is September 1st. Like, we need to start this no later than September 1st, but ideally tomorrow. And then the question is, or today would be fine too. The question is the only way I can sign up through that email? Like, do I have to go back to my inbox and dig out an email that I may have missed, or is it in my portal?
Inbox, email, and it's linked. So there's a special link in your email that attaches just for you, that attaches your Citizen unique identifier, so that we can link the data. So we can link your seizure tracker to your Citizen data.
And who's that email from, just so I can search it?
It is from, it was in one of my slides. Let me pull it back.
It should be research in Vitae. If you just search in Vitae in your inbox, it's definitely from our support team.
Okay. In Vitae, yeah, you're right.
There.
In Vitae research studies.
Yep, in Vitae research studies, and then the title is
Invitation to participate in Vitae Citizens Rare Neurological Disorders Study.
Oh, right there.
I just want to add something on this really quick. I don't think I mentioned this to Virginie, but so that you don't have to track the 30 days, right? To know like, which day did I start this? Which day should I end? The reminder emails will only come out daily for 30 days. So if you use those emails as reference to, hey, submit, and once you don't get an email anymore, you finish the 30 days. So just wanted to let everyone know so they don't have to mark it on their calendar, just follow the emails and it'll help you complete all 30.
And I'll be tracking this closely. And we'll be sending out the one-on-one reminders. We're pretty good at chasing people. I told the Praxis team that they didn't have to worry, that Syngap was going to show up and we're going to have all those seizure trackers filled out. So we need to do it.
Awesome. Well, if there's no more thoughts, I think we've made the point. I just want to emphasize my point, which is deep thanks to Karen and Kelly and Praxis for caring about our kids, and to Ivy and Virginie over at Invitae for making this really hard work possible. Because that's what's happening here. We're going to be able to compare medical history with EEGs, with parent-patient diaries. And that would have honestly, if I asked a researcher to do that, they would have sent me a proposal for 3 years and some stupid amount of money. Yep. That would have resulted in a paper in 5 years, if we're lucky, that maybe somebody would read. Whereas this is going to result in data that we will understand by the end of the year. And none of us have time to waste because our kids are getting bigger, stronger, and more complicated, right? So let's get on with it, people. We have work to do. Thank you very much.
Thank you, Mike. Thanks, Virginie. Thanks, Lauren.
Thank you.
Thank you, everyone.
Bye.
Bye.
Bye.